Breastfeeding can be challenging, especially in the early days after pregnancy. There are many challenging factors that could potentially prevent a woman from lactating. However, new mothers feel judged when they are not able to breastfeed their babies, and often perceive themselves as the only ones failing, when there are many new mothers that feel the same way. Many new moms are often told the breast is best by other mothers and healthcare workers. Unfortunately, not all mothers and their baby have the same response and behavior to breastfeeding. The American Academy of Pediatrics recommends that infants be exclusively breastfed for about 6 months. However, there are many reasons why women do not breastfeed or do not exclusively breastfeed their infants for as long as it is recommended. Some of the most challenging factors are sore nipples, low milk supply, breast infection, and fungal infection. Therefore, when new mothers are unable to breastfeed their babies, they begin to develop a sense of guiltiness because they are not able to meet the nutritional needs of their babies. This guiltiness is not justifiable because their bodies are not able to produce milk physically because of environmental issues. Unfortunately, the idea that their bodies are the source of food to keep their babies alive becomes the idea that their bodies are not good enough. This mentality becomes the idea that they are not good mothers on their minds, which is a very emotionally draining thought. Sore nipples are one of the most common factors for issues when lactating in the relationship that a mother develops with their baby. Breastfeeding should be comfortable, but when pain is part of the process of feeding your baby, a sense of discomfort begins to take over, causing a mother to become more distant with the baby. Sore nipples are often the side effects of bad breastfeeding positions, and the baby only suckling from just the nipple instead of the areola and the nipple. Another issue is low milk supply, in which a mother worries about not having enough milk to maintain their baby's immune system healthy and growth. The amount of breast milk that a mother should be producing should be enough to support the growth of the baby. Breast milk supply should be based on the weight of the baby. If the baby is growing and gaining weight, then breast milk supply is good enough. Plugged ducts feel like a tender and sore lump that also prevents breastfeeding. A plugged duct happens when milk ducts does not properly drain, then builds up and the surrounding tissue gets inflamed. Often plugged ducts can lead to breast infection. Mastitis of breast infections is inflammation on tissues around the breast. Breast infection can often cause the soreness or a lump in the breast that causes vomiting, nausea, fever, and yellowish discharge. Lastly, fungal infection, also called yeast infection, can form around the nipples or in the breast. This type of infection thrives on milk and is an overgrowth on the candida organism.